India has not reported any cases of the human metapneumovirus, which is believed to be behind the surge in infections in China. According to Dr. Atul Goyal, India's Director General of Health Services, there is no cause of concern regarding the current situation. Dr. Goyal stated that HMPV, like other respiratory viruses, typically causes flu-like symptoms in the elderly and young children. The hospitals are prepared for seasonal outbreaks.
News doing the rounds about a metapneumovirus outbreak in China. Let me be very clear on that count. Metapneumovirus is like any other respiratory virus which causes a common cold. And in the very old and the very young, it could cause flu-like symptoms. However, we have analyzed the data of the respiratory outbreaks within the country. There is no substantial increase in December 2024 data, and no cases which have been reported in large numbers from any of our institutions. In any case, during winters, there is an increased outbreak of respiratory virus infections, for which our hospitals are usually prepared with the necessary supplies and the necessary beds. One thing I would like to convey to the public is to take the general precautions that we use against all respiratory infections, which means in case somebody has cough and cold, he should avoid coming in contact with a lot number of people so that the infection does not spread. And while using a distinct hanky or towel for coughing and sneezing, and take the normal medicines that are required for cold or fever whenever it's there. Otherwise, nothing to be alarmed about the present situation.
He further advised people to follow general precautions for respiratory infections, such as avoiding close contact with others if you have a cough or cold, to prevent the spread of infection. An expert from the Indian Medical Association on Saturday stated that the virus does not cause fatalities like COVID-19, but can, in some individuals, lead to lungs infection. He explained, HMPV is not a killer virus. It does not cause severe pneumonia or deaths like COVID in the early stages of the pandemic. Pertinent to mention that HMPV, first discovered in 2001, is part of the pneumonoviridae family, alongside respiratory syncytial virus. The US Centers for Disease Control and Prevention list common symptoms of HMPV, including cough, fever, nasal congestion, and shortness of breath.